Renew used a better way of doing evoked potentials. We call it multifocal visual evoked potentials, or MVP. This better way of doing VEPs allow us to actually measure the change in amplitude. Amplitude means the strength of the signal as the information is transmitted from the eye, specifically the retina, to the part of the brain that processes visual information. We call it the visual cortex. The strength of this signal has been very hard to measure. But using multifocal VEP, because it is a lot more sensitive and it measures a wider part of the visual pathway, we were able to discover something very new. The patients who entered this study called Renew came with one affected eye by acute optic neuritis and one normal eye. So we assessed what was happening to the so-called normal eye or fellow eye. And what we noticed, measuring the amplitude of the MVP, is that the visual pathway on the so-called normal eye was, over the 8 months of the study, actually being affected. The amplitude was gradually being diminished, and that is never good because we rely on amplitude to transmit information. What was even more important is that the group that was treated with antilingo did not experience such a loss. So this is a new and important finding where the group that had antilingo on board during those 8 months was prevented from this loss of amplitude signal. We believe that is important because MS is a chronic disease and we would like for the patients to preserve the function of their brain. So this data is pointing towards the possibility that perhaps one day we may have treatments capable of doing that. Amplitude can only be tested electrophysiologically. So you need a machine that's able to measure, we call it an evoked potential. The strength of an evoked potential, it's almost an electric magnetic field coming from the neurons in the surface of the brain. So it cannot be done simply by a neurologist or by a human being. It needs a machine. The standard way of doing visual evoked potentials is readily available at any neurology clinic that diagnoses MS patients. But multifocal VEP was actually developed specifically for this clinical trial. There were some machines being used mostly in a few academic centers, so they're not readily available. It raises the issue of whether we should be measuring physiology as part of care of MS patients better, but that's maybe more for the future. We view this as one of the best biomarkers we have to detect early injury and repair. So it depends where the field is going. One day, this may become as common as MRI, but right now it's a research tool.